What's new in Appointments 3.4? Appointments Release 3.4 contains the following new features for all users. Clipboard improvements. The Appointments clipboard now displays in orange when it contains copied, moved or imported appointments. Recording a did not attend code. You can now record a did not attend code onto a patient's record directly from Appointments when a patient fails to attend an appointment. Simply hover over a patient with a DNA status, select Options and record DNA. A DNA entry displays on the patient's clinical record. You can also record a DNA code for multiple patients. Simply select Options and Bulk Updates. Then select Record DNA onto clinical record. You'll then be prompted to select a date range and record the DNA code onto selected patient records. Bulk updating web availability. You can now bulk update free appointment slots to make them available or unavailable for your patient to book online. From Options Bulk Updates, select Toggle Web Availability. You'll then be prompted to select a date range and enable web bookings for selected slots. Bulk updating incomplete appointments. You can now bulk update the status of incomplete appointments from the past 7 days. For example, if a clinician frequently forgets to close the last patient they saw before leaving for their house calls. From Options Bulk Updates, select Review Incomplete Appointments. You'll then be prompted to select a date range and change the status for selected slots. Show today's free slots. You can now select Show today's free slots to quickly display appointment slots available to book for today. This next new feature is for practices that access appointments from within Vision 3. If a patient is not registered for online services, you can now select the new online registration button on the patient's booking form to register the patient. Patient warnings and reminders. Patient warnings and reminders now display on the booking form and on the patient banner. Note, if Show Discrete is set, you have to select the warning to view the details. Lastly, for practices that access appointments from their desktop, for example shared care users, from the Appointments clipboard, you can import multiple patient lists or add patients to an existing list without replacing previously imported patients. You can now also book concurrent and non-concurrent joint appointments within a specified time frame with one or more clinicians, for example, an appointment with a doctor and another with a nurse. To learn more about the new updates, from Appointments, select Help, and then select What's New. You can also visit the Learning Zone to watch videos, complete short e-learning courses and gain a certificate.